Isn't it curious that whilst as women we all have or have had menstrual cycles, there's so much variation. Let's take the bleeding bit, for example. For some of us it's light and others it's heavy, and some of us have a lot of pain, some of us have no pain. And then, of course, a lot of us have those dreaded side effects of mood swings. Well, it's a bit like, as every woman's unique, we all have periods with different personalities. So I'm delighted today to have with me Dr. Alyssa Burns-Hill, who's a hormone and holistic specialist. And with many TV appearances, books and articles under her belt, she's promised today to help us unravel some of the mysteries of the menstrual cycle. Welcome today, Alyssa. It's lovely to have you with us.
Oh, thank you, Harriet. Thank you for inviting me.
That's a pleasure. Should we start by looking at some of the basics of the menstrual cycle? You know, how long is it supposed to be? How long is the bleeding part? You know, give us an idea of what we're supposed to expect anyway.
Okay, well, your menstrual cycle really does have your own particular identity as part of it. The actual bleed can last from just a few days to maybe a week, whereas the whole cycle can last anywhere from sort of maybe 21 days to even 35 days. So you can see there's quite a broad scope for both of those features of your period. The thing is to remember that your periods, the day your period starts is day one of your menstrual cycle.
Okay.
So that's day one. So you would then maybe count how many days you're bleeding for. Okay. And then you will count until the first day of your next period. And that is the length of your menstrual cycle, not your period, but your menstrual cycle.
Right.
And it's always wise to keep track of your particular pattern. This is mainly true for women who aren't on the pill, because if you're on the pill, then your natural cycle is being suppressed and modulated by the hormones that you're taking. Okay, but if you're having a natural cycle, you should keep track of your menstrual cycle so that you can be aware not only of when it's coming, but also if there are any changes.
And are there any useful apps or so on that we might be able to use that help us do this, perhaps, in the modern world?
Yeah, there are some apps actually that help you track your cycle, and it's worth just going online and checking them out and see which one would work best for you.
Okay. And what about the hormones involved in the menstrual cycle? What are they and what do they do?
Okay, the two main hormones are estrogen and progesterone. And estrogen is secreted by the ovaries, and that is the dominant hormone during the first half of the period or menstrual cycle. Okay, it's on ovulation. It's the little corpus luteum, the egg sac, that is actually a little endocrine secreting gland that produces progesterone during the second half of the cycle.
Okay.
And so progesterone should be the dominant hormone during the second half of the cycle. And what that does is, well, during the first half of the cycle, the estrogen stimulates the growth of the lining of the womb.
Okay.
And then the progesterone comes in and is the dominant hormone, and that actually matures the lining of the womb in preparation for the period, or alternatively for implantation of a conceptus if you're conceived.
Absolutely. Okay. So I mean, after all, the period is just about that, isn't it? Preparing our bodies for a potential baby.
It is, yeah, and it's just basically it's a regular housekeeping mechanism.
Okay. When I watched your video on your website, Alyssa, you also mentioned that as women approach their 30s and 40s, you know, they start to stop ovulating. Is that fairly common? I mean, is that part of the menopause setting in?
It's not necessarily the menopause setting in. Textbook says that women stop ovulating regularly around the age of 25. Okay. However, I'm a sort of a firm proponent of the fact that no woman today will ovulate regularly. And that's partly down to, well, it's lifestyle and diet of younger women today. So they're not going to get into a regular cycle. So if we but as we do get older, then yes, we do naturally stop ovulating on a regular basis. And this is where things like heavy periods and fibroids can become an issue for a woman. And that's because you're not getting the progesterone coming in during the second half of the cycle. What happens is the estrogen continues to dominate, so it grows a thicker lining of the womb. And that means you have more material to lose in your monthly cycle.
Okay. So when people do have sort of extra thick blood or clots in their period, is that quite normal? I mean, does it happen regularly with some people, or is it variable as well between individuals and within one person?
Yeah, it is variable, and again, it's about what would be normal for you. But for women that do have particularly heavy clotty periods, then it does tend to indicate that there is an excess of estrogen going on with the body, and these women can very often recognise signs of PMS. Like tender breasts, mood swings, bloating, water retention. So that all is part of the picture, but also this is where the higher levels of estrogen can stimulate the growth of fibroids in the actual body of the uterus, and then that can become a problem that can lead to higher or worse periods in terms of how much you're losing, very heavy periods. I have worked with women who've been bleeding for 6 months continuously.
Wow.
That's and their doctors have been telling them to have a hysterectomy because that was the only way to stop it. Well, it can be turned around. So you don't have to have a hysterectomy because you're bleeding all the time. There are more natural routes that will support hormone balancing, which will address that problem. So, but it is the influence of estrogen that will do that.
Okay. So that explains, for a lot of people why they're getting premenstrual symptoms and, severe mood swings. But can women get those symptoms without those sort of other symptoms of heavy bleeding?
Generally, it's all sort of part of that picture because it's estrogen that will make your breasts tender. Okay. And the reason that is, it's also headaches as well. The reason is because your body, estrogen, the hormone, will make your body retain more water, which is why the jeans don't fit maybe before your period. That's a normal place where most girls notice that there's a problem. Okay. But headaches, because your brain will retain more water, and also your breast tissue, and they become tender and sore. Sometimes women report sort of feeling like they've got glass in their breasts. It can be very, very painful. It's again because of water retention, actually sort of really squeezing that delicate tissue. Okay. And it's only when your period comes that your body actually lets go of all that excess fluid. So have I answered your question, or have I gone off on a different
No, I think you have. It was about PMS and why, some people are prone to it and others not.
Right. Well, but apart from that, one of the other critical factors is sort of maybe how your depth of experience in that regard, and that can relate to adrenal function and your adrenals or your stress glands that sit on top of your kidneys. Okay. And if you've had a very stressful life and your threshold is actually quite low, then your natural ability to be able to tolerate the mood swings and the tender breasts and all the things that go with PMS is going to be much less than somebody who's perhaps feeling a bit more robust in themselves.
Okay. Moving on from PMS to other symptoms that you might get, or irregularities in your period, are there any times when a woman should think, that's not how my period normally is something wrong? Are there maybe factors of time of life that would influence that? And when should really someone go and see a doctor?
Yeah, there are a couple of examples that pop into my mind. Sometimes, and I work with this on a regular basis in my clinic, young women, 15, 16, are actually put on the pill to regulate their cycle because they have a very irregular or painful period. Now that's just masking the symptom. And then these women end up in my clinics in their sort of late 20s, maybe their 30s, because they want to have a baby and they came off the pill 6 or 12 months ago and nothing's happening. This can be the time that women discover they have a very common hormonal imbalance called polycystic ovarian syndrome, which actually means that your ovaries, instead of releasing the egg properly on ovulation, it causes a little cyst on the ovary. And that creates hormone imbalance, and it can mean an irregular cycle that hasn't been identified previously, and so they weren't aware of it. It's very hard for medicine to actually identify this, and usually the treatment for it is to put a woman on the pill. So it's not really a treatment, it's a management strategy. But again, there are natural ways of bringing back better balance that means that your cycle can be more natural and also overcome any potential fertility issues. Another area would be perhaps for a woman going into her late 30s or early 40s where her cycle does change dramatically. As she does start approaching the menopause. The menopause or the perimenopausal transition can last for up to maybe 10 years.
Goodness, that long.
So that's fun. Yeah.
I look forward to that.
You can go through a time where you can make it, for some women, they have normal regular periods. Then one day they stop. No flushing, no nothing. That's it. That's their menopause.
Wow.
I have spoken to women who have had that experience. But on the other end of the spectrum, we've got women who are having really heavy periods. Their hormones are up and down, which is perfectly normal during the perimenopausal transition. It can cause periods to be more frequent. They can be less regular. They can be heavy. They could just be a spotting event. But the thing with menopause, it's not just about hot flushes and night sweats. It can be about increased wakefulness, so trouble sleeping, increased feelings of anxiety or perhaps depression, of just feeling like you're not coping very well anymore, that you're losing your memory. All these types of things are all signs that maybe the perimenopausal transition is happening to you. So it's wise. It's not just looking at your period and what's happening there. It's maybe thinking, well, how am I feeling? What's going on?
Well, thank you for that. I mean, it seems like at the end of the day, if there's a change that's irregular to you, then that's the time to ask a doctor about it, just for reassurance to know that things are happening naturally or there's no underlying problem.
Yes, absolutely. And if you track your period or your menstrual cycle, then you're going to know with confidence that something's amiss.
Yeah, and what the norm is. Well, that's super. Thank you so much for your time today, Alyssa. It's been really enlightening.
You're welcome.
Before I let you go, can you tell our audience where they can find more about you and your work?
Oh, yes, I'd love to. Thank you. I've got a website at dralysaburnshill.com. So DRALYSSABURNS-hill.com.
Fantastic.
And I've also got a book on that you can find on Amazon called Weight Loss Winners and Dieting Downfalls. That's actually about the hormonal influences that can improve your chances of losing weight or managing your weight or sabotage you in your best efforts.
Well, that sounds a must read, I think. Well, thank you for that. It's been an absolute pleasure having you on today, and hopefully maybe we can catch up again soon and talk about more issues to do with hormones.
That would be lovely, Harriet. Thank you.
Thank you so much. So that was Dr. Alyssa Burns-Hill, who joins today from Salisbury, and Alyssa's a leading hormone and holistic specialist, and she joined us today from Salisbury, but although she also has an office in Harley Street if you want to visit her there. I'm Harriet Seeger with Wellbeing Examiner, and I'm a single mum, and I've been a medical journalist for nearly 20 years now. But enough about me. I want to hear from you. Do you have any particular struggles at the moment, maybe to do with your menstrual cycle or something else? Please get in touch with me, Harriet, at the email that should be on your screens now. That's harriet@wellbeingexaminer.com, and I'll do my best to find an expert to answer your questions. But in the meantime, together, let's be happy, healthy single mums.